What's up, beautiful people? Another day, another study. We often talk about dementia because I'm an ApoE4 carrier. I have a higher risk of developing dementia, and I watched that my grandfather passed away from complications of dementia. Well, this study was specifically looking at young onset dementia, which is a different clinical entity than what people typically think of dementia, someone in their 80s. This is happening in people under the age of 65 and seems to have a different risk profile. And this was a study using a national database in Korea. Why Korea? Because 99% of the population is enrolled in their health program. And so they have access to tons of records. They take lifestyle, blood work, all of that together. So you get access to a lot of information. This was looking at metabolic syndrome, which is a cluster of findings that includes elevated waist circumference, triglycerides, blood pressure, blood glucose, LDL-C, and then low HDL. It's associated with cardiovascular disease and mild cognitive impairment. This study was looking at its risk with young onset dementia. So they looked at just under 2 million participants aged 40 to 60, and they were followed for an average of almost 8 years. 25% of the population at baseline met the criteria for MET-S, and they used markers significant for their population. So the markers for obesity are less than what we use for Americans or other populations and Asian populations. So they actually did correct for that. And after adjusting for confounding variables, those with MET-S had a 24% higher risk of young onset dementia. And actually, those who were diagnosed earlier had a higher risk. And the more criteria of MET-S that you met, metabolic syndrome, the more risk. So they indicated a dose response relationship. Having all 5 components was associated with a just under 70% increased risk. The mechanism is thought to be due to things like chronic inflammation, vascular dysfunction, endothelial dysfunction, which is dysfunction of the blood vessels, and arterial stiffness, and insulin resistance over a prolonged period of time. So this is why I'm pretty aggressive in correcting metabolic dysfunction, even in younger people, because the longer that dysfunction accumulates, the worse off it is for our health.